mom like you, and in this picture I kind of see her when she was in the hospital. From the moment you became a mom, you've given so much, cared so much, loved so much. You've always had a way of making ordinary days special, and you've made special days times to remember.
They were kind of telling us, she's severe pre-eclampsia, but don't worry because the cure for pre-eclampsia is delivery. 48 hours later, after her being admitted, they did a C-section on her. At that point, it's like the baby's out, your wife's gonna be fine. There was no discussion with the high-risk doctor about any of this, and she was sent home. She's had multiple pregnancies, she's over 42, she's diabetic, she'd had in vitro fertilization, she'd had miscarriage, she'd had the issues with potassium, she had some family history behind her, so there were probably 7 or 8 red flags that should have been considered. We were discharged on a Sunday. That Tuesday, I had gone back to work in the morning. She had gone to the doctor with her brother, with Sophie. She was experiencing a lot of shortness of breath at that point, so he got her back home and put her to rest. I'm exhausted, so I go to bed at around 11, and she wakes me up at about 12:15, and she's like, I need your help. And I'm like, well, what's the problem? She goes, I can't breathe. And to me, it looked like she's hyperventilating. She's just getting very anxious, and she's getting very excited. So my job is to calm her down. So there's no warning bells going off in my head at this point. I'm not thinking I need to call 911 immediately. I'm not thinking I need to put her in the car and take her to the hospital, which is literally 5-7 minutes from here. She is devolving rapidly in front of me. She's, asking for cups of water. She's asking for cups of ice, and she's dumping it over her head. I mean, her arms are just, this. At that point, I'm like, okay, I don't know what's going on. So I called 911. And in the span of that call to them arriving here was probably about 7 minutes. She went from standing to sitting to laying on the floor to not breathing. The last thing she said to me was, I love you. It took them 25 minutes to establish a pulse. Over the course of 2.5 weeks, that's how long she stayed with us. I think I said, I'm sorry to you every single day. Everybody says, well, don't blame yourself, but, that's easy to say. It's another thing to be the individual that was the one witnessing everything that happened here and supposed to be the protector of the family. The ending doesn't change. There's never a happy moment that comes from it. But if somebody else can live because they've heard this story and understands, what pre-eclampsia is and takes it a little bit more seriously when talking to their patients, or as a patient, they understand what the symptoms are and they're not afraid to speak up, then something comes from this. And that's what I hope.